The new year bringing with it a warning from doctors of asthma patients. Come January 1st, a popular inhaler Flovent is being pulled from pharmacy shelves and replaced by a generic version. Joining me now with the consequences to millions of Americans are healthcare attorney Harry Nelson and Dr. William Feldman. Gentlemen, 27 million Americans suffer from asthma. That's 1 in 12 Americans, including 1 in 10 children. I'm just going to start with you, Dr. Feldman. This medication is most commonly used inhaler for years. This is a big deal for asthma patients, I know, but I've also understand that a generic version doesn't make it any less than the name brand. Is that true?
Any less in terms of the price?
Any less as a person of its efficacy?
That's right. So the generic version it functions just as well as the brand name version. The issue here is that a lot of insurers may not cover the authorized generic version. And so patients who are currently on Flovent may actually have to switch their inhalers.
And therein lies the problem. You know, that is the point that was lost to me there. Hadn't even thought about that. So the fact is, there are those who, Mr. Nelson, are on a budget and may find themselves in a situation where now the drug has become more expensive.
Yeah, absolutely. This is a case where American consumers and the patients, the families that need this inhaler, are paying a price because of the financial strategy of the pharmaceutical, of the drug maker, which was trying to basically dodge a penalty that was going to come into effect under what's called the Medicaid drug rebate program. So basically, in order to avoid paying money to the government, GSK, the pharmaceutical, is making it harder financially on American consumers.
Gotcha. So is there a potential problem with insurance coverage then, you believe?
Oh, absolutely. The problem is that the current branded form of the drug is approved on these formularies, and that's a process that takes a lot of time to negotiate. And so this new generic is not recognized by any of the insurance companies as a valid alternative. And so basically, patients and their doctors are going to have to figure out an alternative.
Yeah, and according to the Allergy and Asthma Network, annual healthcare costs for asthma is roughly $82 billion, or about $3,300 per person a year. It is a big business, Mr. Nelson.
Oh yeah, this is, and by the way, the cost when it comes to generic, a lot of people know that generics are typically cheaper than branded drugs, but in this case, the average cost of the branded version, that when the government pays for it or insurance pays for it, is about $275, and this is going to drop it down to about $170. So this is a big ticket item for a chronic need that patients are going to have throughout the year to get inhalers, and this is a massive financial burden being shifted from a drug company to patients, and that's something feels wrong about that.
It does indeed. Dr. Feldman, what are you then telling your patients, some of whom I have to believe are a bit concerned, if not panicked, about what the change could mean?
So I will say that there are alternatives to Flovent products. Aside from the authorized generic, there are other branded medications in the same class that can be used. And so the key is for folks who are switching to make sure that they are educated about how to use their new inhalers, because different inhalers require different techniques. So I think the shock to patients can be offset by proper education and counseling.
Gotcha. So then why is the maker, and I'll ask you this too, Dr. Feldman, why is the maker, GlaxoSmithKline, making the change to begin with?
So the main reason appears to be a new law that is going into effect January the 1st in just a couple of days that lifts a cap that had previously applied to rebates paid in Medicaid. So it's a very complex, nuanced issue. But at the end of the day, by lifting this cap, GSK, for certain old drugs where the prices have been hiked numerous times over the years, companies like GSK will actually have to pay the government, pay Medicaid money when patients are using their products. Rather than actually receiving money, they're actually paying money. And so for these old drugs that again have experienced numerous price hikes, the new law will have an effect on GSK's bottom line and other manufacturers.
Dr. Feldman, once again, this all sounds like something we've heard echoed time and time again, that there needs to be some type of overhaul or reform in the way medication is not only priced but distributed. Are there new laws regarding prescriptions beyond this that have that are raising concern for you, Dr. Feldman?
So I think the Inflation Reduction Act passed in last year, and I think that will allow Medicare to negotiate prices for the first time. I think that will be good for patients. But there are so many parts of our prescription drugs system that are a mess, and I think there are numerous changes that are needed in the coming years.
And last question, Mr. Nelson. January 1st is Monday. If asthma patients haven't already made the switch, what can they do now?
They should be reaching out to their doctors to get prescriptions. There's a product, Pulmicort, put out by AstraZeneca, that seems to be a popular replacement, a lower cost product that's similar, but they should talk to their doctors about it. And if I can, just to add one point, just to make this clear, the reason this is happening is because the price of this drug doubled over the last 10 years, so close to doubled, when inflation only went up by about 75–80%. So they would be responsible for paying that whole difference. The drug company would be responsible to pay that. So I think that we're going to see this on a lot of drugs for chronic conditions, because the drug companies have been raising their prices every year, and they have not paid attention until now. Until Monday, they didn't have to worry about whether they were raising their prices more than inflation was going up.
Mr. Nelson, with a warning that this may be only the tip of the iceberg. Mr. Nelson, thank you. Dr. Feldman, thank you both. Happy holidays to both of you.
Thank you. Happy holidays.